Okay. All right, so we're going to begin talking about what anatomy is. And let's see if I can. Now, what does the word anatomy, what is anatomy? Anatomy is, we wrote, the scientific study of body structure. Another word for structure is morphology. Morphology just is another word for structure. Morphology comes from the Greek morphos, meaning shape or structure. But let's look at what the word anatomy itself means. One of the things that we're going to be learning about in this class is, as we said earlier, is terminology, anatomic and medical terminology. Has anybody had a class in medical terminology? So you'll know, when I say this, that when you take a class in medical terminology, they make you learn all these Greek and Latin roots. And all these clinical words are just made up of lots of Greek and Latin roots that are joined together. That's basically what creates all these medical terms. So anatomy is made up of two Greek roots, ana and tome. Anatomy, ana and tome. So what does it mean? Tome means to cut, and ana means up. So anatomy is basically the study of cutting up stuff. Because obviously that's how they studied anatomy, is they cut up cats, they cut up the human body, and so that's what it is. But I want to, before I go any further, show you how we use these roots. So I want to focus on the root tome. Tome means to cut. So let me give you a couple of other examples where we see that root tome. So if we have the word, for example, how about a tonsillectomy? So in the word tonsillectomy, can you see the ending? Tomy. That's tome. So it means literally to cut out the tonsils. Appendectomy, right, to cut out the appendix. But let's use an example of tome or tomy where it's a little bit more complicated. Earlier today, I showed you my website, and we wanted you to watch a video that describes a CAT scan machine. Does anybody know what CT or CAT stands for? Right? You've heard of a CAT scan. So it stands for computerized axial tomography. All right, well, we know what computers are, so this device must use a computer. Axial refers to the axis of the body. So our major axis is this vertical line that extends right through the middle of my body and divides me into a right and left half. All right, and then tomography. Notice the root, here's the root tome, as in the word anatomy or tonsillectomy. There's the tome. Tome means to cut. Graph is a picture, an image or a picture. So computerized axial tomography gives us a picture or image as if we had made cuts or sections through the body. So a CAT scan creates these images as if we had made a whole bunch of sections or cuts through the body. So you get these serial sections and without actually having to cut anybody or chop them apart. So that's how it gets that term, axial tomography. Sometimes for short, and they'll leave out the word axial and they'll just write CT, right? Computerized tomography. So we could give you lots and lots of examples of tome where it appears. Now, I mentioned anatomy is the scientific study of what the body looks like, its structure. In addition, it's how the body develops. And we're not only going to learn the structure of an adult, we're going to learn the structure of an embryo and a fetus. And in fact, in my mind, that's one of the most fascinating parts of anatomy, is learning about how the baby develops. Actually starting out from a single cell and developing into an embryo, into a fetus, and into the adult structure. So we will learn about the development of the body as well. Now, many fields when you take a course in sociology, you take a course in psychology, they will commonly tell you about some of the major so-called fathers of that field who are very important in the initial development of that discipline or field. In the case of modern human anatomy, the father of modern human anatomy is named Andreas Vesalius. Now, it's not so much I'm going to test you on the name of this guy, but Andreas Vesalius, or his real name was Andre Vesely, was a Belgian physician who lived in the 16th century. 16th century is the 1500s, and he's considered the father of modern anatomy. What he did is, as a physician, he taught at a medical school in Belgium, and he would pay grave diggers to dig up human bodies out of the cemetery so that he and his students could dissect the human body and see what's inside. And he made some very beautiful drawings that are still considered some of the finest anatomical drawings that have ever been made. He compiled all of these drawings into a 7-volume work called De Humani Corporis Fabrica. You don't have to know that. You do not. Which is Latin for the workings of the human body. And these are all these beautiful anatomic drawings that he did based on these bodies that were dug up out of the ground. Now, there's a lot of controversy about how he did this. Technically, he was paying grave diggers to dig up bodies that had been buried, but he preferred fresh bodies that had not decomposed or deteriorated. So the grave digger started bringing him some really fresh specimens, and it was always suspected that to bring very fresh specimens and to reduce the amount of work of having to dig up the body out of the cemetery, they were just killing people. They were murdering people and bringing a really fresh body, and that way they didn't even have to expend effort to dig the body back out of the grave, and they got paid for it. So the beginnings of modern anatomy have some questionable origins. Another thing I wanted to mention is the nomina anatomica. Nomina anatomica, this is Latin. It literally means anatomic names. Nomina's names. And every year or every couple of years, the International Congress of Anatomists meets, and it's an international body, and they agree on the official names of the different parts of the body. Now, the main point that I want you to appreciate is that when we learn, let me get Mr. Skeleton Man here. So when we learn that this thigh bone, this bone of the upper leg, the thigh bone is called the femur. That name femur is internationally agreed upon. That's the name that it's called everywhere in the world. So if you were taking an anatomy class or attending medical school, it wouldn't matter if you were studying anatomy or medicine in the United States, in Iran, in China, in Kenya, in Germany. The technical scientific name of the thigh bone is the femur. Now, how they'd spell it would be with their own alphabet, because different languages use different alphabets, but everybody, when they say the word out loud, it would come out femur. That's what it's called. That's the international scientific name. And so when we're learning these names, these are not just names that we use in English. People who know English don't know these names because they are the scientific names. They're not English names, they're not German names, they're not Chinese names, they are scientific names. Now, many of you have to take physiology. And commonly students will say anatomy, physiology, I think they're the same thing. Well, they're emphatically not the same thing. They're very different. Physiology is a scientific study of how the body works, how it functions. Not what it looks like, but how it functions. And physiology, the way we describe how things work, is largely in terms of biochemical processes. That's why physiology, we want you to take chemistry before you take physiology, because there's a lot of biological or physiological chemistry that is used in describing how the body works. Let me try to drive home this difference between anatomy and physiology using a car as an example, an analogy. Let's imagine we're looking at a car. I open up the hood of the car and we're looking down at the engine. So if I start to point to the different parts of a car engine, I say, see this? That's the battery. You go, duh. Yeah, I knew that. Okay, so I say, this is the battery. This is the radiator. This is the, here's the fan belt. This is the engine block. Let's open up the engine block, and inside the engine block, there are these chambers called cylinders, and what goes up and down in those cylinders are pistons. What I'm describing is the anatomy of the car engine. We're learning what these different things are called, what they look like, and what they're called. What would the physiology of a car engine be, if that's the anatomy? The physiology of a car engine is explaining internal combustion. Because the way that car engine functions or works is through a chemical reaction called combustion. And we would have to explain how hydrocarbon molecules are combusted with oxygen, releasing an explosive release of energy that makes these pistons move up and down. Obviously, before we can learn how the engine works, we first need to know what the different parts of the engine are called. Similarly, before we can learn how the human body works, we first need to know what the different parts of the human body look like and what they're called. Does everybody follow the difference? So physiology is more advanced, more sophisticated, more complicated than anatomy. Anatomy is really memorizing a bunch of names. Physiology is understanding these chemical and physical processes that, to explain how it works. In physiology, you use concepts that you learn about in chemistry courses like Boyle's law and Laplace's law, and you learn about volumes and pressures and so on in order to explain how the human body works. Okay, let's talk about anatomy, though. That's our course. So the human body, the study of the macroscopic, macro means big, the large structure, macro, the macroscopic body is called gross anatomy. Gross means big, right? So if you learn the different parts of the whole human body, the whole macroscopic, meaning what you can see with your own eyes, that's called gross anatomy. I guess some people think it's called gross anatomy because it's gross, disgusting, but it's called gross because it's big. Now, in this class, not only are we going to learn gross anatomy, what the different parts are called and what they look like, we're going to also tell you a little bit about surface anatomy. I want to give you 2 examples of surface anatomy right now. We're going to learn much more about these examples later. One example of surface anatomy I want to mention is something called the sternal angle. The sternal angle, or angle of Lewis. So it's called the sternal angle, or angle of Lewis. You'd say, what's the sternal angle? So if you were to take your finger and rub this bone right here. Now, in English, we would call this bone the breastbone. I don't care what it's called in English. I'm not going to test you on English names. And the scientific or anatomic name is the sternum. This is the sternum. When you rub your hand, your finger, over the sternum, you'll feel a bump. Go ahead, try it. Rub your finger right over your sternum, and as you rub it up and down, you'll feel a ridge, a bump. That bump is called the sternal angle, or sternal angle of Lewis. Now, why do we care? Feel that bump, that ridge. Go ahead and do it. If you can't find it on yourself, how are you going to do it on a patient? All right, when you feel that bump, just to the sides of that bump are ribs. That's the second pair of ribs. The second pair of ribs are attached right where that bump is. This is the first pair, here's the second pair. You'd say, why do we care? Who cares? Second pair of ribs, so what? That's the top of the heart. So the top of the heart, how we locate the top of the heart is, right, we feel that little bump or ridge called the sternal angle. That's the level of the second pair of ribs. That's where the top of the heart is, right? We don't just say, as a future nurse or a physician's assistant or something, we don't just say, oh, your heart, oh, it's somewhere in there. We need to be a little bit more precise than simply say it's somewhere in here. All right? So that's how we locate it. Now, a second example of surface anatomy I want to give you is the spinous process. The spinous process of the 7th cervical vertebra. All right, the spinous process of the 7th cervical vertebra. Now, you say, what the hell's that mean? So on the back of our vertebral column, we have these spines. You can feel them, right? You feel those spines or spinous processes on your back. Now, what does cervical mean? Anybody know what cervical is? Neck. Cervical means neck. So we want to specifically locate the spine or spinous process of the 7th cervical vertebra, the 7th vertebra of the neck. That's very easy to locate because you can palpate it. Does anybody know what the word palpate means? Palpate means you can touch or feel it. So to touch or feel. So you'd say, what do you mean, palpate, to touch or feel? If you feel the back of your neck, on the back of your neck, you'll feel a spine, a prominent spine, a bump on the back side of your neck. That bump, that spine, is the spinous process of the 7th cervical vertebra. So it's used as an anatomic landmark. These are called anatomic landmarks. Now, you'd say, wonderful. Now that I palpate or can feel this bump or spine of the 7th cervical vertebra, so what? Could you feel a spine right below it? All right, well, there's a spine below it. Can you feel a spine below that? You'd say, yeah, it's a little bit harder to feel. Well, if you count 2 spines below the 7th cervical, that's the top of the heart on the backside. The top of your heart, when you're trying to locate it on the backside of the body, is 2 bumps, 2 spinous processes below what's called C7. C7 is the 7th cervical vertebra. It's called C7. So you count 2 bumps or spinous processes below that prominent bump, and that's where the top of the heart is on the backside. These are known as anatomic landmarks. Anatomic landmarks. There's a lot of this in medicine, so that we feel or palpate different parts of the body so we know where the different organs are located. And in fact, the vertebral column is really in many ways used like a yardstick for locating not only where your heart is, but where your kidneys are and where other organs of the body are located. We're going to be learning more about this. So, this is just an introduction for right now. These are examples of what we call surface anatomy. If you're going in, you want to become a nurse, you want to become a physician's assistant, a physical therapist, an occupational therapist, a radiology technologist, you're going to be learning how to feel or palpate the different parts of the body so you know where they are. So that's part of what's known as a physical examination of the patient. All right, regional anatomy. What's that? Regional anatomy is when we study the anatomy of the body by area, by region. For example, who in the class is interested in going into dental hygiene or dentistry? All right, so dental hygiene, I know. Anybody interested in dentistry or dental hygiene? So, all right, so when you enter the dental hygiene program, in the very first semester, you're going to have head and neck anatomy. This is the area you're going to have an entire semester-long course just on this. Because if you're working in the mouth, you sure as hell better know the head and neck. Because that's where you're going to spend all your time every day looking at that patient's head and neck. That's called regional anatomy. You could, not only is there head and neck, if somebody wanted to go into podiatry, what's podiatry? All right, so a podiatrist is somebody who's licensed to do medical procedures on the leg and foot. So they don't study all of human anatomy. They focus on leg and foot anatomy. That's the region that they study. You can have head and neck regional anatomy, leg and foot. You could have chest or thoracic anatomy. A hand surgeon is going to be focusing on hand anatomy. People going into physical therapy or occupational therapy. Does anybody know what one of the major distinctions is between a PT and an OT? Anybody? Yeah.
An occupational therapist is focused on getting them jobs, like how they can function in the workplace. And physical therapist is function on more like day-to-day, being able to like, regain muscle strength.
What are the, yeah.
Isn't educational more fine motor versus growth hormone?
Any others? Yes.
Occupational therapy tried to take the patient back to work what he do for a living, so they tried to mimic what he do at work. Was physical therapy practically similar?
One of the main distinctions between a PT and OT, OTs primarily work with the hands, the arms and hands, the upper extremities. PTs primarily focus on the legs. Now that's not the only distinction. Some of you mentioned others, but most physical therapists are helping people walk. Most occupational therapists are helping people use their hands. So that has to do with which region or part of the body they focus on. Now both OTs and PTs will learn both arms and legs, but they focus more on either the upper part of the body or the lower part of the body. All right, so that's a regional anatomy. If somebody wanted to go into obstetrical nursing, you'd say, what do you mean obstetrical nursing? If somebody's going to be a midwife or basically work in the maternity ward, then they better know the pelvic anatomy very well, shouldn't they? Because all day long, they're going to be delivering babies out through the bottom of the pelvis. So they really have to know pelvic anatomy well. Okay, radiological anatomy. Radiological anatomy is where we use different techniques to see the inside of the body. So radiological anatomy basically involves using various types of scans. Scans of the body, images of the body. So let me mention a few types of scans, of ways of scanning the body. So one example, first, one of the simplest would be X-rays. X-rays, right? You can get an X-ray scan. Now, X-rays, and we'll have more to say about this later at another time, X-rays primarily allow us to see bones and teeth. So we take X-rays to see if you broke an arm bone, right? Is the bone fractured or broken? We, in people in dentistry or dental hygiene, use X-rays to see if there's holes or cavities in a tooth. So the X-rays primarily allow us to see hard structures like bones and teeth. Now, we can actually use X-rays to see soft tissues rather than bones and teeth if we use dyes. So an example of using a dye along with an X-ray would be something called an angiogram. We're going to, I didn't do it today, but maybe next class meeting we're going to put out some X-rays and other types of things so you can get a sense of this. Has anybody ever heard of an angiogram? So an angiogram is when they inject a dye into the bloodstream so they can see a blood vessel. Without the dye, you can't use an X-ray to see a blood vessel. It won't show up on an X-ray. It only shows up bones and teeth. So they, yeah.
Is that the one with contrast and without?
Yeah, it's called a contrast medium. It's usually a type of iodine. There's all kinds of contrast mediums, or dyes, as it were, that can be introduced into different parts of the body. If anybody's ever heard of an upper or lower GI, it's where they introduce barium, which is a metal, into the digestive tract and take an X-ray image, and then you can see the outlines of the intestine. So without using the dye, you can't see it with an X-ray, but using the dye allows you to visualize it. Other things besides X-rays and angiograms, we mentioned earlier a CT scan or CAT scan. So what's a CAT scan? Well, this is where I'd like you to watch that video that's linked on my website. If you have the textbook, your textbook, and I didn't require you to use it, get a textbook, but textbook, all these things I'm covering right now are in chapter 1 of every anatomy textbook. And in chapter 1, they would talk about the different ways of visualizing the inside of the body. We already said earlier today, CT or CAT stands for computerized tomography. This is where they use X-rays, and they basically beam X-rays in a 360-degree plane through the body. And by creating these images around the entire body, they use a computer to reconstruct what a section of through the body looks like. And again, watch the video that's linked on my website. It's a YouTube video, so you can understand this better. So it shows, has anybody ever had a CT scan done? Yeah. So you remember, if you've had it done, they wheel you on like a gurney, and there's this thing spinning around. It's really like a camera, as it were, and it's taking these images. And they'll move you through, it'll whirl around, and then they'll move you a little bit further, and it'll whirl around again. And each time it whirls around you 360 degrees, it creates an image, as if they had made a section right through your body.
Is that the one have a really loud sound?
No, we're getting to the one that has the really loud sound, yeah.
Did you say it stands for computerized topography or tomography?
Tomography. It's this word that we wrote here earlier. Tome as in to make a cut, like anatomy is to cut. So that's a CAT scan. It does use X-rays, so it uses X-rays. So to the extent that X-rays can be harmful to us, obviously a simple X-ray, an angiogram which uses X-rays, or a CT scan uses X-rays. This is radiation. Now, there are other devices that allow us to see the inside of the body that do not use X-rays. An example of that is an MRI. Anybody know what an MRI stands for? Yeah, it stands for magnetic resonance imaging. Magnetic resonance imaging. Sometimes they'll just say MI, resonance imaging. And this is where they use a magnetic field. Now, creating these very high magnetic fields to visualize, to create images as if they'd made sections through your body, creates a very loud noise. Right. And they use it very commonly for images of the head. So it allows images of the brain, for example, to be probably the clearest, even better than a CT scan. So this is where they'll put you into basically a tube. You get very claustrophobic, and you hear this hammering sound, which is the magnetic field, the change in the magnetic field, and usually that procedure takes about 45 minutes. About 45 minutes, you're inside an MRI machine. So incidentally, they have technicians who do all these things. So as other types of health-related fields are to be a CT technician, an MRI technician, and so on to run these devices. Watch the video linked on my website that shows you an MRI. I want you to understand the difference between an MRI and a CT. But does an MRI use radiation? No, it uses a magnetic field. The big concern here with an MRI is that somebody doesn't have any metal in their body, because a magnetic field causes metal to move. So if somebody has any piece of metal, that magnetic field's going to cause that metal to start moving through their body. Also, if they have a battery-powered pacemaker, not only is it metallic, but that magnetic field's going to stop that battery-powered pacemaker from working. So you will see wherever there's an MRI machine, it has a warning to stay away from that area, that facility, if you have a battery-powered pacemaker.
So it's not only for brain, right?
It's not only for brain. They use it for other...
I had this and I did it for my back.
Yeah, it's commonly done, though, for brain spinal cord injuries.
When you say stay away, I mean, can you walk by the building?
Well, you can walk by. They don't want you going into it where the
They don't
magnetic
want you
field
going
would be
into it.
measurable.
Wow.
Yeah. So, and that's why they usually put the MRI machines in a separate building. Like at a hospital, it's usually in a separate building or in a basement, unlike the other devices. Now, another way of visualizing the inside of the body is with ultrasound. Ultrasound doesn't use X-rays, and it does not use a magnetic field. It uses, we'll call it sound, very high-frequency sound. And it bounces high-frequency sound waves off the part of the body. Ultrasound is considered the safest of these various techniques, and that's why they use ultrasound to see babies in the womb. Because they don't want to look at babies with an X-ray, or because X-rays are radiation that can cause genetic mutations, and they are also reluctant to use MRI, magnetic fields. So they use ultrasound. So that's called sonography. They also use ultrasound for other purposes. Earlier, there was a couple people who said they were interested in going into radiology tech. Is that right, or something? Is anybody interested in radiology tech or ultrasound? So you can get images of the inside of the heart and the arteries using an ultrasound. That's known as an echocardiogram. And again, watch the video linked on my website that shows you an echocardiogram using ultrasound. We want you to understand the difference between a CT, an MRI, and an echocardiogram done with ultrasound. These are different ways of visualizing the inside of the body. All of these ways of scanning or getting images on the inside of the body fall within this area called radiological anatomy, using these various devices. There are many others, but we'll just leave it at that. There's PET scans and other things as well. They use radioactive isotopes and so on. In terms of radioactive isotopes, if you know of anybody who has had diagnostic tests for cancer, they will commonly use radioactive isotopic tracers to see if the cancer cells have reached their lymph nodes and so on. So, yep.
So EKG, electrocardiogram?
That's no. The electrocardiogram is not a scan of the body. It's not anatomic. That's functional. So electrocardiogram is something you'll learn about in physiology. That has to do with the electrical current flow through the heart. All of these are techniques or ways that in the medical sciences we use to investigate and evaluate the human body. And that's why this is called medical science. You have to learn your knowledge of science, chemistry, physics, biology, to understand how physicians and dentists and nurses and occupational therapists and everybody else study the human body. They use scientific methods to analyze it. They use, we've all had blood tests where they analyze chemicals in our bloodstream. And they will measure cholesterol levels in your blood. They'll measure glucose levels in your blood. They'll measure fatty acid levels. They'll measure red blood cell counts and white blood cell counts, all to evaluate and assess the condition of the body. So this is what medical science is about. All right, now we can divide the human body into organ systems. So in chapter 1 of the textbook, or also I believe exercise 2, I think, or exercise 1 in the lab manual, and you don't need the textbook, so let's focus on the lab manual, which you do need to get. In exercise 1 of the lab manual, it summarizes the major systems of the body. I'll say them very quickly. You don't have to write it down, because you're going to look at exercise 1 in the lab manual. All right, and also I've got links on my website. So we're going to be learning in this class the skeletal system, the muscular system, the digestive system, the respiratory system, the urinary system, the circulatory system, the endocrine system, the lymphatic system, the reproductive system, and the nervous system, and the skin or integument. I think there are 9 systems. So we're going to be learning all these different systems of the body. And when we study the human body by systems, digestive system, circulatory system, reproductive system, that's called systemic anatomy, learning the body by systems. And that's the most common way that introductory anatomy class analyze the body, is by systems. Now, the nervous system is, without question, the most complicated of the systems, and they give a special name for the nervous system. They call it neuroanatomy. Neuroanatomy is so damn complicated that you can literally take an advanced course in just neuroanatomy, the anatomy of the nervous system. It's usually offered as an upper division or graduate course just on the nervous system, because of its complexity. Now, the organ systems of our body, such as the digestive system or the reproductive system or circulatory system, can be further subdivided into organs. So, for example, and this is all covered in Exercise 1 of your lab manual, the digestive system would include, the esophagus, the stomach, the duodenum, the jejunum, the ileum, the different parts of the colon. It would include the liver, the pancreas, and gallbladder. All of those are organs of the digestive system. A female reproductive system would consist of ovaries and fallopian tubes and the uterus and the mammary glands. These would all be part of the female reproductive system. So we're going to be learning which organs make up different systems of the body. And again, this is all in the Exercise 1 of the lab manual. I have an old edition here. Doesn't really matter. In Exercise 1, they have pictures, and let's see if anybody has that. Let me just borrow that picture. So the lab manual, again, doesn't matter what edition, but when you look at it, I'll just show you what it looks like. We're going to be talking about this. This is Exercise 1 of the lab manual, and this is, here's where, actually it's Exercise 2. Exercise 2 says Organ Systems Overview. And it goes through, right here, there's a whole chart in Exercise 2 of the names of the different organ systems and the organs that make them up, right? So here, just to show you, this is Exercise 2. Here's we just talked about for example, the digestive system. And here it says, digestive system is the oral cavity, esophagus, stomach, small and large intestine, the teeth, the salivary glands, the liver, and the pancreas. So you'd say, what, do we have to know that? Yes, you will need to know that. That's the second exercise in the lab manual. So this is why we recommend a college-level biology class before you take this, so you've at least got some introduction to the parts of the body rather than no knowledge of the body. Because we need to know the organs that make up the different systems. Now, organs, such as the stomach, such as the heart, such as the ovaries, are in turn made up of tissues. Now, the study of tissues is called histology. It comes from the Greek root histo, meaning tissue. Histo means tissue, so the study of the different tissues. We're going to be learning about these tissues in this class. We're going to be learning about epithelial tissues. Epithelial tissues, if I can spell it. Epithelial tissues, connective tissues, muscle tissues, and nerve tissues. These are the four major types of tissues in the body. It's okay if you don't know what these are. That's what we're going to be learning. But we're going to be learning what's an epithelial tissue, what's a connective tissue, what's a muscle tissue, and what's a nerve tissue. These tissues make up organs. Every organ is made up of two or more tissues. Every organ is made up of two or more tissues. And again, you'd say, is this in the lab manual? Yes, it is. Do you have links on your website that cover this? Yes, I do. You'd say, can you show us? Okay, I'll show you. All right, so here's the website. And here's the link where you can watch a video on CAT scan, a link to watch an MRI, a link to watch ultrasound and echocardiogram. In terms of the different systems, here's a link as an introduction to the various body systems. And you can watch that video. So for all these different topics, there's resources. All right. So the tissues, the epithelial, the connective, the muscle tissue, the nerve tissues are in turn made up of tissue cells. Tissue cells. An adult human is made up of about 60 trillion cells. The study of cells is called cytology, coming from the Greek root cyto, meaning cell. Cyto means cell. The study of cells is cytology. And if you've had college biology, you learned cytology. You learned about cells. But we're going to be covering it. It's in chapter 2 of the textbook. It's exercise 3, I think, in the lab manual. Now, one of the most amazing things that I could say about the human body, in fact, one of the most amazing things I could say about any living thing, is that all living things begin life as a single cell. It's hard to imagine. You started out one cell big. All living things. A whale begins as one cell. A redwood tree begins as one microscopic cell. So all living things develop from a cell. That's why we're so interested in cells. Now, the name of the very first cell you started out as was called a zygote. A zygote is also called a fertilized egg, a fertilized ovum, or zygote. We'll learn more about this. And that's the name of the first cell you began as, a fertilized ovum or zygote. Now, that zygote increased in numbers of cells, and you grew in size and shape, and then you were born. Now, when you were born, were you fully grown? No, you continued to grow after you were born, before you reached your adult size and shape. So then the question is, well then why were you born? If you weren't finished growing, why didn't you keep growing inside your mother? The answer was, because you're getting too big to keep growing inside your mother, you're going to have to do the rest of this growing outside your mother. So birth doesn't end the growth or development process. It simply separates it, where the rest of it after birth has to occur outside the mother. The entire process of going from a zygote to an adult is called developmental anatomy. And we're going to learn how we go from a zygote to an adult. It's one of the most fascinating parts of this entire course. Now, we do separate this. We talk about development before birth and development after birth. The development before birth is known as embryology, or prenatal development. What does prenatal mean? Literally, before birth. Prenatal. You know, at Christmas time, it's common for people to put out what are called nativity scenes, right, of Jesus, right? Nativity scenes. Why is it called a nativity? Because it's from the Latin natal, birth, right? Birth of Jesus. So that's natal. Prenatal, or embryology. Now, what is teratology? Anybody know what teratology is?
It's the study of things that happen in the womb, isn't it?
Teratology is a study of birth defects, birth deformities. A very, very important subject, birth defects, birth deformities. They can range from things that are not too serious, such as a cleft lip or a cleft palate, right? We've all seen that, where somebody might have a cleft lip or cleft palate. They can be surgically fixed. to things that are very serious. Some babies are born with holes in their heart. All right, much more serious type of deformity or defect. The study of these birth defects and deformities is called teratology. You'd say, well, should we know that? Of course you should know it. You need to know everything I'm saying. All right, so whatever I cover, you're responsible for. All right, so question?
Embryology then underneath it.
Embryology is just a prenatal development, mean the same thing.
Okay.
That's the development before birth. Now, what is comparative anatomy? Comparative anatomy is when we compare different species. Now, in this class, our focus is human anatomy. But we will be looking at a cat to help us learn human anatomy. Incidentally, almost all introductory anatomy class use a rat or a cat or something like that. We don't have beginning students dissect a human. All right? For two reasons. Number one, most of us have no idea what to do, and we don't want you butchering a human. All right? If you're going to make a mess, we'd rather have you tear apart the cat than a human. Secondly, humans, because they're much bigger than a cat, take much longer to dissect. Much more complicated, more difficult to dissect. So it's larger, takes more time. So, but in general, the anatomy of a cat and the anatomy of man are almost identical. In the few cases where there's some differences, and there are a few cases where there's some differences, we will compare the anatomy of the cat with the human. We'll learn, for an example, that's the way some of the arteries come off the aortic arch are a little bit different in the cat than in humans. Sometimes the way they come off in a cat, we do see in a human. That's known as an anomaly. An anomaly that would be found in humans, where it looks more like the cat rather than a normal human. But now, what is pathological anatomy? Anybody know what the root patho means?
Disease.
Good, disease. Patho is a Greek root meaning disease. So the study of abnormal anatomy, abnormal. It's abnormal because, meaning it's not normal, it's because of disease, it's because of injury, it's because of deformity. That's pathological anatomy. In fact, those doctors, those medical doctors or physicians who study to the greatest extent disease are called pathologists. Most of us are familiar with pathologists because we've seen a TV show called House. So if you've ever watched the TV show House, have you ever seen that? So that's about a pathologist who happens to be crazy, but he's a pathologist. So every episode, they have usually a patient or at least one or two patients where they're ill and they don't know what's wrong with them. And the whole idea is they have to go through a whole procedure of testing this and testing that and testing this to figure out what's the pathology, what's the disease, what's wrong. So they're the most expert in identifying disease. All right, so we're going to be talking about, these are different branches of anatomy. So anatomy is not one thing, it's divided into many different subdivisions. Okay, on the next page, and I know you're thinking, my gosh, this guy it's like the first day of the semester, and he's like lecturing, and it's like, you know, why aren't you like all the other teachers who just let us out when you're done? Because we're serious. All of us in this class want to go into healthcare fields. We're a different type of group. We're not like my Bio 3 students. Bio 3 students who I'm going to meet very shortly at 1, I'm going to lecture to them the whole time too, because that's how I am as a teacher. They're going to go crazy because they're not used to it. You are. You are in the sense that you're serious as a student in this field. They're not serious, my Bio 3 students. All right, but, all right. So, and there's a lot to cover. Anatomy is a big subject. All right, anatomic relations. Now, when we want to explain, when we want to describe where is an organ compared to another organ, where's one part of our body located, we have to first agree on the position that we're in. Because where a part of our body is located would depend upon whether we're standing up or lying down, whether we're curled up. So we first have to agree about a reference position. We need a reference position, a position of reference. So that when we describe where is an organ or one part of our body relative to another, we are describing that the position, assuming the person is in this anatomic or reference position. What is the anatomic or reference position? It's what Mr. Skeleton is in right now. He's standing upright, head facing forward. The palms of his hands are facing forward. That's called the anatomic or reference position. That's exactly what we wrote. So, body erect, arms are at the side, palms are facing forward. Anytime, every time we explain where something is, we always assume anatomic position. Take a look at page A5. I think it's A5. Yeah, A5. On page A5, all right, this is anatomic position, right here. Anatomic or reference position. So that's always this position we assume somebody's in when we describe how where something is located. Now, back on page A2. Back on page A2. So back on page A2, now what we want to do is introduce you to some terms. There's a lot of terms in anatomy. These terms are used to indicate relative positions. So these are for describing relative positions. For describing relative positions. All right, and what I mean by that, because you say, what does that mean? That means if I'm trying to describe where one part of our body is compared or relative to another part. So relative means compared to another part. All right, so let's just show you what we mean, and then it'll be more clear. It's not that complicated. I would suggest learning these terms in pairs. So the first pair of terms are 1 and 2, superior versus inferior. Now a synonym for superior, what's a synonym? Means the same. Another word that means the same as superior is cranial. Superior and cranial mean towards the head. So when I say use the word superior or cranial, it means towards the head. A synonym for inferior is caudal. Inferior and caudal means towards the tail end, the bottom end. This is the head end, this is the tail end. So here's an example of how we use these words. Example, your heart, at least in the anatomic position, is superior compared to your liver. You'd say, what? Okay, let's think about it. Okay, where's the heart? The heart is up here in your chest. If you don't know that, you got to take biology. Okay, the heart is in the chest. Your liver is in your abdomen. Which one is closer to your head? Your heart is closer to your head than your liver. It's superior or cranial compared to your liver. Now, I could have said it the opposite way. Your liver is inferior compared to your heart. Your liver is inferior or caudal compared to your heart. These terms, superior and inferior, are used to compare one part of your body with another part. So if we could take any two organs and we can ask which one is superior and which one is inferior. Which one's closer to your head? Which one's closer to your bottom end? All right? Here's another example. Your stomach is located inferior compared to your lungs. Does that make sense? Your stomach, again, is down here in your abdomen. Your lungs are up in your chest. So what did we just say? So your stomach is inferior or caudal compared to your lungs. Or I could say your lungs are superior compared to your stomach. Now, there are many, many examples, that you can practice with. In your lab manual, in exercise 1 of your lab manual, so here's how you can practice this. You'd say, am I going to have to get the lab manual? Yes, you are. So you'll notice that this is right in exercise 1, and it's listed under body orientation, direction, plane sections, and you can see here's all these terms that we're going to be learning: anterior, distal, frontal, inferior, lateral, medial, and it asks, for you to write this out. The heart is what compared to the vertebral column and to the lungs? The elbow is what compared to the shoulder? These terms are used in every branch of the healthcare field, in nursing, in PA, physician's assistant, in dental hygiene, in OT, in PT, radiology tech. They use these in all these different clinical fields. They also use these terms in terms of describing surgical procedures. This is the jargon that's used. So when they're trying to describe where you insert a catheter or you make an incision, they use these terms so that we're precise as to how you're going to do this. It's not complicated. None of anatomy is complicated, but it requires reviewing and repetition and learning the terms and their meaning. There is a lot of jargon, a lot of terminology. I really view an anatomy class as a medical terminology class. This is really medical terminology. Let's just go a drop further and then we'll call it a day. The next pair of terms, I would just learn them as a pair: anterior and posterior. Anterior means towards the front of the body. Posterior or posterior means towards the back of the body. A synonym for anterior is ventral. You'd say, do we have to know that? Yes. A synonym for posterior is dorsal. So let's just, yes?
I've heard it used as frontal, and I forgot what do you accept that or no? Is that...
Well, if it's in your book or lab manual, yeah.
Oh, okay.
All right. So the anterior ventral. So an example is this is a very important clinical example. The trachea is anterior to the esophagus. You'd say, what the hell are those? Again, this is why you should take biology before this class. Your trachea is your windpipe. That's the tube that air goes through. It's called your trachea or windpipe. The esophagus is the food tube. Why don't you feel, we're just going to do this and stop for today. Feel the front of your neck. Can you feel this thing with these rings of cartilage? That's your trachea or windpipe. Right behind it is your esophagus. So your trachea is in front of your esophagus. It is anterior. It is anterior or ventral compared to your esophagus. In other words, we have a trachea, we have an esophagus. Which one is closer to the front of the body? The trachea is. That's an important thing. As a future nurse, as a PA, you may have to trach or intubate a patient. You better get the tube down the right pipe. Otherwise, you're going to blow air into their stomach rather than into their lungs.